A very good day to you, our lecturers, our fellow lecturers. My name is Priscilla, and along with me, I have my group mates, Husna and Iza. So we're presenting on our final project on eating disorders. So I'll start off with introduction without any delay. So slide. So the first point that I would like to touch is eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors, and they are also associated with distressing thoughts and emotions. So they can be very serious conditions affecting physical, psychological, and social functions of individuals' daily lives. Like they're not able to do the things that they usually do. So the second point would be, so there are few types of eating disorders. So types of eating disorders here include anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, and other specified feeding and eating disorder, also known as pica and rumination disorder. So these are the types. Some types of the eating disorder, they're actually much more. So the third one would be uh, eating disorder often develop in adolescence and young adulthood, most often. So several, especially anorexia nervosa and bulimia nervosa, are more common in women, but they can all occur at any age and affect any gender, male and female. But it's most common in women uh, and females. So eating disorders occur in close to 5% of the population and typically emerge throughout adolescence and early adulthood. So my final point for introduction would be there are three main types of eating disorders, most common here in Malaysia. So those three are anorexia nervosa, bulimia nervosa, and binge eating disorder. So I'll pass it to the next presenter now.
Okay, thank you so much, Priscilla, for the explanation. So I'll begin with the intervention that I decided to use in handling eating disorders client. So there are three. The first one is cognitive behavioral therapy, family-based treatment, and the third one is reality therapy. So I'll begin with the first one, which is CBT. We all know that CBT is a therapy that is related with our cognitive and related with our behavioral. Our cognitive leads to our behavioral. So in this therapy, we basically help clients to acknowledge and be aware more of their thinking, make them focus and realize about what are they thinking, and acknowledge what kind of thinkings that client been thinking regarding their disorders, which is eating disorders. And as a counselor, we focus more on the negative feelings of the client that leads to the negative behavior, which is the negative feelings is sometimes eating disorders patient, they are um, diagnosed with depression or anxiety, and all these and all these disorders actually lead to eating disorders, which is such as the anorexia, bulimia, and binge eating disorder, and so on. And then continue with the second intervention, which is family-based treatment. Family-based treatment. Basically, this treatment, we are not too focusing on the patient, on the client, but we focus more on the outpatient, which is the family of the client, especially the parents. We give the task and we ask the parents to help the client and make sure that the surrounding of the client is supportive, and the siblings play their own role to help the client to overcome these eating disorders. And then lastly is reality therapy. Reality therapy basically the counselor is only part of the counseling session, but the main is we are the solution or the solve is basically come from the client, from the patient. We only help them to acknowledge what are they thinking, what are they doing, what do they really want, and that they need something in order to survive. And in this reality therapy, as a counselor, we can implement some of the counseling skills such as summarizing, paraphrasing, and active listening. Basically, we don't do much techniques on solving the problems, but we make the client realize, and we help them realize and acknowledge more about the disease or the disorders that they are going through. So by implementing all these counseling skills, it will help client to be more uh, appreciated, feel being appreciated and being listened by us. I'll pass to the next present. Thank you.
Thank you, Husna. So for the limitation of the intervention, there are some limitation for patients with eating disorder, among them anorexia nervosa, bulimia nervosa, and other patients with relate with eating disorder with hide their feeling, we tell the psychologist. So for the technique cognitive behavior therapy, which is a CBT, I take a lot of time to attend a regular CBT session and to complete any additional work between the session. So the patient with a very severe eating disorder, so the CBT technique is a form structured technique. So it's not appropriate for patient with a particularly complicated the mental issue in eating disorder. So for who suffer from severe eating disorder and self-harm. So for the next other limitation, which is a family treatment, patient with eating disorder may not be supported during a family treatment because and the therapy willingness to deal with family issue are more important than knowing or solving the patient eating disorder problem. This is because the potential problem faced by family members are more important than whether the patient or not. The last limitation is reality treatment. This is doesn't not pay much attention to the patient, which is a patient with eating disorder are more closely to the mental disorder. So especially those who are suffering mental health. So the study show that Glaser operates mental health does not require medication. So for the patient eating disorder, they need medical help for the special to control this eating disorder disease. For example, a patient with complex eating disorder can harm himself or herself, then they need medication. So this will show that the reality therapy is not quite challenging to use for patients with eating disorder. So for the next slide is a role of the counselor. Counselor have a to help their clients. So this is a very important for therapy recovery patient to facing eating disorder. So there are the way to explore client with the eating disorder problem. First is identify and deal with the counselor of the client eating disorder. This is an effective program to detect the underlying cause of the individual eating disorder and generate workable solution to address it. For example, someone who is depressed may overeat to reduce their emotional stress. So counselor can depression with effective treatment strategy, which is reduce argue to overeat. So patient and counselor can work together, give more emphasis to help them weak. The patient may keep a food journal to better understand the type that lead to being eating. However, this is not the patient attitude and behavior. This is not enough. So, patient and counselor must investigate the mental problem underlying the disorder to achieve lasting treatment. Next is setting goal. Setting goal is an enable the client to hold himself or herself accountable for the accomplishment of client objective. So goal setting is not only can affect mental health, but they also support recovery and struggle with depression. Once a patient have complete the little objective, they frequently feel inspired and to because one. For example, client removing himself or herself from social network that make a client feel very maintain a daily eating schedule and repeating a happy word every day to combat a negative thought. So goal setting can help boost confidence to the client who suffer with eating disorder. The last point is role counselor can work with the comprehensive therapeutic plan. Successful plan for prior to multifaceted approach to address the physical and psychological problem associated with eating disorder. For example, counselor can work with nutrition, psychiatrists, and other medical professionals to develop a joint treatment plan, promote nutrition knowledge, and healthy coping mechanism. So that's all for me. Next.
Right, thank you, Lisa. So I'll continue with the conclusion, the final part of our presentation. So firstly, psychological, behavioral, nutritional, and other medical issues are often handled in the case of eating disorders. So to summarize, eating disorders should therefore be handled not only in the aspects of nutritional and other medical issues only, but also in the aspect of their psychological and behavioral issues as well. So finally, most of the time, individuals who are suffering from eating disorders, they need an adequate amount of mental support from their family members, from mental health professionals, and people around them, because just like healthcare support it, so because these disorders is usually because of mental health issues such as anxiety, overthinking, and etc. So giving them the mental health they need, just like providing health care for them, is equally important to them in order for us to help them come out of the shell eventually. So, yeah, that will be it from us today. Thank you.